This is a famous, you can write this down. It's right up here. Gray's Anatomy, 1989, 37th edition. I don't know whether that's all I have. Why? Because one of my mentors, laser, Dr. Mary, oh, who's just slipped my mind. Anyway, she gave a talk about laser, and she turned out to be one of the editors. So if you look at this book, this anatomy, and the Mary Dyson, Dyson. I'm not sure whether she's still alive. You know, when I met her 20 years ago, she's already in her 70s. I called it the grandmother of a laser therapy, and she's great. Oh, wonderful. And then when I went up to her in the conference after her talk, she says, if it's anything chronic, you have to make it acute. Once you make it acute, you can apply laser to help healing. It was a aha moment. It's like, oh yes, because you cannot use a laser to break up the scars. You cannot use a laser to melt. There's no such thing to melt the scars. You have to use needles and friction massage to break up the scar. Now, what happened to the scar? This is acute inflammation. And you'll see this in 37th edition's beautiful picture. So this is what I did. I add in this so people can see the 3 phases of healing: inflammation, proliferation, and remodeling. And these are the cell numbers, relative cell number. So if it's dirty cut, this is a cut through the skin, cut through the muscles, cut through the blood vessels. So it's bleeding. So it's a nasty. Remember, most of tears is in the muscles. Yes, you never see bruises unless you fall or you get hit by a baseball, something. Then you see bruises because you also break the blood vessels. No, usually typical tear don't see the bruises. But if there's a bruises, then you know, okay, bruises healed, and then there's definitely a problem. But this is a cut. So imagine this is a cut, a not very dirty cut, but it's a relative enough to mobilize macrophages. So these macrophages come in and gobble up all the germs and all that. So I call it 911 crew. And that's 3 days. So it's going to take 3 days for these macrophages come into the injury area, clean it up. Then what? It's cascaded. It's beautiful. Body knows exactly what to do. What's coming in? The macrophage says, all right, I've done my job. I'm going away. And the fibroblast cells coming in. And I call it patching. Your body has no time to do one fiber repair at a time. It comes in, start patch it. Patch it. Because there's a lot of broken tissues in there. Oh yeah, bleeding stopped because these congealed and platelets come in. It's all beautiful. They come in. They know exactly what to do. Remember, inflammation is giant red flag. I'm here. I'm in your buttock. I'm in your buttock. And the body go, okay, I'll come to the buttock. And this is a cut, so I'm going to clean it up. And then the scar start to form. And this is about 3 weeks, 20 days down here. Remember, this is dayline down here. Then this is the most critical. All the chronic pain patients, by the time they come to you, they have no healing phase happen in their body. Anything over 3 months, that's 100 days. Patient can say, I have pain for 6 months, 1 year, 5 years. In your mind, you know, nothing in their body is able to heal them. That's why they are chronic pain patients. That's why their doctors keep prescribing what? From painkillers to narcotics. And why you think we have an opioid crisis? They all start with painkillers. So I belong to University of Arizona Integrated Medicine program. If you know Dr. Andrew Weil, he started integrated medicine, and part of their kind of like teaching staff that they send before pandemic, they send doctors, they from all over the world, if not all over the country, to Tucson, and they want to learn integrated medicine, and they sign up some chiropractor, acupuncture, massage therapists, and one of their teaching staff on the acupuncture side. So some of these doctors come to my clinic, shadow me. I make sure they know, please, 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 when you start practicing, understand this. Never, never prescribe ibuprofen. I just show you that paper in the first hour. That paper was just published telling doctors, wait a minute, any acute pain, please do not prescribe ibuprofen, anti-inflammatory NSAID. And then what? What can they do? Well, I tell these doctors, refer them to acupuncturists, for God's sake. This is exactly what we do. We do needles. We put needles in there. We create more micro-inflammation. And you can say qi and blood, but if you say micro-inflammation, they understand it. And the body says, oh yeah, I'm going to swamp this area with more fibroblasts and everything start going. And you tell patient, no ice, no ibuprofen, keep moving, and body beautifully moving to the remodeling phase less than 3 months. Otherwise, it's going to do it in time 3 months. It takes 3. And trust me, we moderners have no patience for 3 months of healing. Nobody. When you have a golfer's elbow, a tennis elbow patient come to you, well, Dr. Jessica, please, I have a tournament next week. I want to play my 18 holes. Yeah. Well, you have a golfer's elbow for 3 months. I'm sorry, you cannot play. So they wanted some magic needles from you. No, you have to explain to them, this is going to take 90 days, 100 days. But if we do this, we can shorten that to about 30 days. Remember, 2 treatments a week, about 4 to 5 weeks. That's about 30 days. Why? Because we put more needles in there, we increase the inflammation, and then we promote that through the scar tissue, and then we add in heat, we add in electricity, we add in laser. Laser really helps speed up this healing. And they move beautifully into the remodeling, and the body remodel this whole thing within 1 month, not 3 months, because by itself is 3 months. But you help speed it up. Then you are a hero, because you cure chronic pain patient within a month. And they will do it because they've been through this for 5 years. If you can cure them in 1 month, they pay for it. Of course, they will pay for it. But you have to explain to them. So I have this readily available in my clinic. I show it to them. I explain this to them. So you can look it up, and probably somewhere in the internet has it. If you want it, and contact Lauren, and then I can supply this. I remember I changed this. I can supply this graph to you, so you can print it out and then show it to your client. And you have to educate them, because every one of them come in with an anti-inflammatory. So here's what happened with anti-inflammatory. When you take anti-inflammatory, what happened? You kill the inflammation. Yes, you kill the pain, because pain comes from the inflammation. But wait a minute, this is the first phase of healing. So when you kill the inflammation, what do? You kill the healing. So the body moves into the scar tissue phase and stop. It never moves on to the remodeling phase. So that's why I say every chronic pain patient walk into your clinic, in your mind, there's no remodeling. You have a bunch of scar tissue. So when you palpate, find that pain in the buttock, bam, that's it. It's scar tissue. So you have to use a fast technique to get rid of that buttocogenic problems.